Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. Today's show is called Heart Health Secrets Your Doctor Won't Share. And trust me, it's juicier than your cousin's peach cobbler. If you've been diagnosed with a heart condition or you're just trying to keep your ticker running like a Swiss watch, the next 5 minutes could literally add years to your life. I'm talking about 3 simple lifestyle changes that we cardiologists recommend most often, but somehow these golden nuggets don't always make it out of our consultation rooms. Maybe we're too busy writing prescriptions, or maybe we think you won't listen, but today I'm spilling all the tea. Let's start with something that'll blow your mind. Movement matters. And I'm not talking about training for the Boston Marathon here, folks. Your heart is basically a muscle that's been pumping nonstop since before you were born. Think about it. When's the last time this poor muscle got a proper workout? I tell my patients to start with just 10 minutes of walking daily. That's it, 10 minutes. You spend more time scrolling through social media while sitting on the toilet. Here's the kicker, though, and this is where doctors sometimes fail you. We jump straight to telling you about those magical 150 minutes of moderate activity per week that all the guidelines recommend. But nobody tells you how to get there without feeling like you're climbing Mount Everest in flip-flops. The secret sauce? Gradually build up. Even light exercise strengthens your heart muscle. I'm talking about a leisurely stroll around the block, not some CrossFit death march. And here's the real secret your doctor won't share. Consistency beats intensity every single time. I'd rather have you walk 10 minutes every day for a year than have you go beast mode at the gym for 2 weeks and then ghost it like a bad Tinder date. Your heart doesn't care if you're not setting any land speed records. It just wants regular, predictable movement. Now let's talk about fueling your heart, right? Because this is where things get really interesting. Everyone's obsessed with the latest fad diet, but here's what actually works: the Mediterranean diet approach. I know, it sounds fancy, but it's really just common sense dressed up with a passport. More vegetables, fish, whole grains, less processed junk. It's like your grandmother's cooking if your grandmother happened to live on the Italian coast instead of surviving on casseroles and canned soup. Here's the part that might make you want to throw your phone. You need to reduce sodium to under 2,300 milligrams daily. That's about 1 teaspoon of salt. Yep, entirely true. I can't make this stuff up. But before you start planning my demise, remember this. Small swaps make big differences over time. Trade that drive-through burger for grilled chicken, swap white bread for whole grain, choose fresh fruit over that candy bar calling your name from the checkout counter. Let me tell you about a real patient of mine, and this story will give you hope. This 58-year-old guy came to see me after a heart attack. He was scared, his wife was terrified, and honestly, his numbers looked like a train wreck. But instead of overwhelming him with a complete life overhaul, we started simple. 5-minute neighborhood walks and swapping white bread for whole grain. That's it. 6 months later, this same man had lost 25 pounds and his blood pressure had completely normalized. When I asked him about the changes, he said they felt like tiny adjustments, not major sacrifices. He wasn't running marathons or eating nothing but kale smoothies. He just made 2 small changes and stuck with them. If that doesn't prove my point about consistency over intensity, I don't know what will. Now, here's the third secret that most doctors barely mention, because we're so focused on diet and exercise, the stress and sleep connection. Chronic stress is like having your heart constantly rev its engine in park. You're burning fuel, wearing down parts, but going absolutely nowhere. Your heart needs 7 to 8 hours of quality sleep every night to recover and repair itself. When you're stressed out and sleep deprived, your heart is basically working overtime without hazard pay. Try 5-minute deep breathing exercises when you feel overwhelmed. I'm serious about this. 5 minutes of deep breathing can reset your entire cardiovascular system faster than you can say emergency room copay. Here's your action step, and I want you to pick just one thing. Either commit to a 10-minute daily walk, swap out 1 processed food in your diet, or set a consistent bedtime. Don't try to be a hero and do all 3, just pick one. Start tomorrow, track it for 1 week, and watch what happens. If you're sitting there thinking this all sounds too simple to work, maybe I should see you in the clinic, we need to talk. Your heart doesn't need complicated, it needs consistent. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.